Now, can you tell us a little bit more about how estradiol affects bone mass, bone loss, things of that nature in a woman's body?
Oh, absolutely. So bones are kind of like underestimated in their critical importance. Everybody knows that you can't be standing up if you don't have bones. You'd be like a little blob on the floor, like a jellyfish, right? So we need a skeleton, right? So, but bones are even more than that. So bones, of course, are critical for maintaining our structure. Bones are also an endocrine organ. They make osteocalcin, which is a vital hormone that helps maintain glucose regulation. It also is important for cognition. So and who knows what else, but we know at least that much about osteocalcin. And inside the bone lies the bone marrow, which is what makes the different components of our blood. I mean, this is like a really, really important. And of course, our ligaments are attached, our joints are where different bones come together and then we allow motility. And a lot of people don't even realize the critical importance of bones to joints. They think that joints is just about the ligaments. Oh, I tore my meniscus, or the coating, that's the cartilage coating, or the cruciate ligaments, and they're not realizing that bone is like what joints are all about. It's like the meeting of two bones, and then you can move things around. And when you lose bone health, you actually lose joint health. So it's very, very intertwined with that. And once again, because every organ system in the body has receptors to estrogen. And that's not an accident. It's because everything is critical for global function and health. Now, in terms of the bone, there are different cells in the bone, and all of them are regulated in a very major way or modulated by estrogen. So if we look at some of the cells in the bone, like the master cell is the osteocyte. Now, the osteocyte kind of overrules things, and it's definitely modulated by estradiol. So under it is the blastocysts. Now, the blastocysts are the ones that make new bone. Okay, they lay down the bone. Now, then there are the osteoclasts. They're actually specialized macrophages. They're from the immune system, and their job is to gobble up. I call them the gobblers. They
Mhm.
can put out like little enzymes, and they like little amoeba kind of things. They can envelop and they can absorb in and dissolve dead and dying old bone. So bone is living. A lot of people think of a skeleton like in an anatomy class, which I had one in medical school, but that is not living bone, right? So that's a whole different thing altogether. So that would be like a petrified forest. The trees are living, dynamic, but a petrified forest is not a living tree. So when you have living dynamic bone, these cells die. And then, like most of the cells in your body, are not the same cells that you were born with. Most cells in your body are new. They're all different ages. Like the typical bone cell will live about 7 years. Different cells in the body live different amounts of years, and then they die. And that's where we get our stem cell pool to replace those cells. Well, the macrophages have to be part of this beautiful dynamic of life, which is getting rid of the old dead cells. Can you imagine if all the cells in your body, when they died, they just stayed there? Like,
Yeah.
what would we be? It's hard. So with these amazing immune cells gobble up the old cells, the yucky cells, the dead cells, and then we can put down new cells. So that's what the osteoclasts do in the bone. They gobble up the old yucky bone, and then the osteoblasts put down the new bone. So it's a dynamic. We call that bone remodeling. All of this is under the osteocytes, which is under the control of estradiol. Every immune cell in the body has estrogen receptors. It's all modulated. Now, when you don't have any estrogen present or very, very low in the form of estradiol, but and then I'll mention about receptors in a moment. But when you don't, then the osteoblasts are not going to do their job. They're not going to put down new bone properly. The osteoclasts are not going to properly gobble up bone. But what happens is when you don't have the right amount of estradiol, you go into this default stage of pro-inflammation. So remember, these are specialized immune cells. So immune cells are part of the inflammatory response of the body. So when you don't have the right estradiol, the osteoclasts become like weapons of mass destruction without any control. So they go like gobbling up like crazy. It's like gobble, gobble, gobble. They keep gobbling up good bone, not just the old dead bone, but good bone. So then you start losing your really good bone too. So that's no good. And then the osteoblasts are not properly replacing it. So you end up in a bone deficit. And you're also not going to make that important hormone, the osteocalcin, either. So that's creating even more havoc in the body. So this is like a really big deal. When women are not even in, like, remember, well, I didn't even tell you, so you might not remember, right? Menopause is a made up term. It's really important to know this. There's nothing in nature that says menopause is, as they define it, 12 consecutive months without any vaginal bleeding. I mean, that's made up. First of all, what if a woman has a hysterectomy? Does she? I've had people say, I don't have a uterus. I had a hysterectomy. Does that mean I don't go through menopause? It's like menopause is not about your uterus. It's about every organ system being impacted. And the way that it manifests in the uterus is through the cycling and the change in having menstrual cycles. But it's about the ovaries and about the hormones made by the ovaries and ovarian senescence or ovarian aging and the steady decline. But during perimenopause, sometimes with like a little roller coaster, it goes up, it goes down, it goes up with the steady down ultimately. But it's about the ovaries, okay? And the uterus and the periods is just one manifestation of hormone changing, okay? So the changes in the bone in terms of bone loss, this vital structure of the body happens before that official arbitrary designation of the menopause, that 12 consecutive months without a period. It's a process. It's aging of the ovaries and declining hormone production. So you can lose a lot of bone before you even get to that final period. And then you have a real escalation of bone loss. And then as people get older, it's the bone loss kind of gets steady but slower and steady. But in the beginning phases through perimenopause and very early menopause, there's a lot of bone loss, and we don't have a way to really put that back well. There's different drugs that do things, but none of them are the same as having hormones and not losing the bone. It's always better to be proactive and preventative, which is why I'm very pro giving hormones during the perimenopause. Why would we wait for late stage disease? We don't do that with any other disease. We want to get on things to be proactive. I mean, why do people check their blood pressure and go on blood pressure medication to prevent heart attacks and strokes? You don't wait until you have a heart attack and stroke and then say, oh, I see you have high blood pressure. Why don't we treat it now? No, we don't want to wait till you have severe osteoporosis and then say, oh, we'll give you this drug and this drug. We want to prevent it. So understanding that loss of these hormones is a gradual process, and we want to get on dealing with healthy maintenance of bone early on in this process. And of course, I always say hormones are foundational, necessary, essential, but not sufficient. So just having hormones isn't enough. You still have to exercise. You've got to maintain proper muscle mass, which also requires estrogen. And you got to do the exercise, the weight training, and the aerobic, of course, for cardiovascular health. And in terms of nutrients, you want to have adequate quality protein. And a lot of it can be plant protein. A lot doesn't have, in fact, we know that bones love plant-based proteins. And as well, you need to have vital minerals and you need to have vital vitamins, like you need to have vitamin D, of course, people know that, and you need magnesium, you need, you need to have calcium, and you need to have trace minerals as well. So, you need to eat all the different across the spectrum, and most people do need a little supplementation because it's hard to get all the vital nutrients that we need just from our food. And then, food is not the same now as it used to be either because of changes in our soil and agribusiness and so on. So bones are a critical
Right.
factor
Mhm.
in aging, and we need to do everything to be proactive to maintain their health.
Wow. It's very fascinating. Thank you, Dr. Gersh. I'm going to switch gears a little bit on you now, and let's dive into women's heart health because, as I understand it, women, quote unquote, they heart attack differently than men. And that is because of estradiol. Can you explain that to us, how that works?